More children within counties in the Lake region are set to benefit from the malaria vaccine, following the plan by the Ministry of Health to expand use of malaria vaccine within the region. Now, the Lake region accounts for majority of the malaria cases reported in the country, with pregnant women and children in the region being at the highest risk of severe malaria. Let's get more from our very own Raquel Mwigai.
6 months since the World Health Organization gave a go-ahead for the use of the malaria vaccine for children in sub-Saharan Africa, the data has been promising. Clinics within the counties of the Lake region, termed as malaria endemic, seeing the reduction of numbers of confirmed cases. And now,
I'm pleased to announce that the ministry has received a positive advisory from the Kenya National Immunization Technical Advisory Group to expand the use of malaria vaccine within the Lake endemic region. This means that more sub-counties within the Lake endemic region will now be able to vaccinate children with the vaccine starting June this year.
At least 275,000 children have received the first of the 4 doses of the vaccine, with another over 45,000 being fully vaccinated. The vaccine being issued in 26 sub-counties in 8 counties of Kisumu, Homa Bay, Migori, Siaya, Kakamega, Bungoma, Vihiga and Busia is normally administered in 4 doses. The first being at 6 months, a second dose at 7 months, a third dose at 8 months and the final dose at 2 years.
And to date, the Global Alliance Vaccine and other funding agencies have committed themselves for the financial support for countries that will need to carry this forward.
The Ministry of Health is now banking on parents and caregivers of targeted children to avail themselves for the jab, as despite the national malaria prevalence standing at 6%, the Lake region malaria prevalence stands at 19%.
This financial year, there was an additional Kenya shillings 800 million made available to the National Malaria Program to be able to implement malaria programs across this country. And these are the funds that in the next few weeks you are going to see a large-scale indoor residue spraying campaign and larviciding, especially in 3 counties. One at the coast, one in central and one in western, that is Kilifi, Kirinyaga and Kisumu.
As Kenya prepares to mark World Malaria Day on April 25th under the theme Harnessing Innovation to Reduce the Malaria Disease Burden, the locally manufactured malaria rapid diagnostic kits developed by Kenya Medical Research Institute, KEMRI, are undergoing validations in the neighboring countries of Rwanda, Uganda, South Sudan and Tanzania, their approval being a boost in the collective fight against malaria in the region. Raquel Mwigai, Citizen TV.